watching Fox 13's Good Day Tampa Bay.
All right, 7:19 now, and this morning in our Health Watch, it's something we don't talk about often, but as we age, it happens to a lot of people. Drooping eyelids. Most of the time, it doesn't mean there's disease, but severe cases can cause a lot of problems. And joining us to talk all about it is oculofacial specialist Dr. Rosh. Dr. Rosh, good morning. Thanks for being with us.
Thank you. Excited to be here.
So let's start with some of the symptoms and how common they are. What are those symptoms?
Sure. So a lot of times patients will come into my clinic and say, you know, I noticed that there's just a change in my vision. There's kind of a decrease in the top half of my vision. Sometimes they'll come in and say, you know, I have this constant brow ache, headache from constantly using my eyebrows to lift that skin off of my eyelid.
So it can cause some pain to the front of the head as well.
It can, and so patients will come in or they'll say, when I'm watching TV, I just manually lift my eyelids and it feels so much better.
And when they look in the mirror, they can also see a difference.
Yes.
It's that saggy, drooping eyelid skin.
Exactly.
What are some of the, you mentioned watching TV, what are some of the other everyday effects that patients are coming to you complaining about?
Sure. Patients will often come in and say that they feel like they can't see as well when they're driving. They really have to turn their head to the left and the right, which we should always be doing, but it's kind of nice to give it a quick glance as well, and they can't do that because they have some hooding there. They feel like they have blinders on.
It can hurt their peripheral vision.
Yes.
We're looking at photos, some before and after, because this is where you come in, the ways that you can help, and you say that the laser-assisted surgery that you do is specific to your practice.
Yes. Yes.
Let's talk about that.
So I'm an ophthalmologist by training, and I did extra years of training in oculofacial surgery, and I'm able to use a laser to perform surgery in the office and at the hospital. Most of my patients, we perform laser-assisted eyelid surgery with the CO2 laser, which allows for decreased downtime, quicker recovery. Patients are able to go back to their everyday lives in basically a week.
Wow, a week's time, and say 10, 15 years ago, what would that recovery time have been?
Yeah, so, you know, the old school way of doing it is using a blade or a Bovie, and the outcomes are great, but, you know, we're in 2023. Patients want to go back to everyday lives a lot quicker, whether it's Zoom calls or back to work or meetings. You know, patients are getting this a lot younger than they did in the past.
That was my next question, is at what age previously would you have seen patients coming to you, and now what does that look like?
Yeah, so patients are coming in younger and younger. You know, they want to enjoy it more. We're in sunny Florida. We live an active lifestyle, so patients want to come in and enjoy it. They want to go back to boating, and they want to go back to swimming and golfing and playing tennis and all those things. And so it's great. They're coming in earlier and earlier, and they got to give me a week of downtime. They can't really do anything for a week.
Complete rest.
Yes, just take it easy, let the body heal, and once I take those stitches out, I kind of clear them to go back to activity.
Last thing before we go to break, what are some things that you really would advise people to be on the lookout for, people who may not quite be there yet where they need surgery, but they may in the future? What are some of the things that you want them to look for?
Yeah, so, you know, it's really important, you know, your vision, your peripheral vision, all that stuff is so important. And if you're noticing there's a change in it, come on in and see me. You know, there's certain metrics that we use to see if this is insurance-based or not. It doesn't change how we do surgery at all. But I think it's important, if you're noticing those signs and symptoms, come on in, let me take a look, and we can discuss it, and you can learn some more information, even if you're not quite ready to enjoy a laser-assisted eyelid surgery.
Fantastic. Dr. Rosh, thanks so much for being with us. Really appreciate it.